Hello everyone, good morning, namaste. In the previous video, I have already talked about the classification of the anticholinergic drugs. Now, today in this video, we will be learning about the atropine, which is one of the most important anticholinergic drug. Okay, so atropine is one of the most important anticholinergic drug. So, the very important thing that you should know about in anticholinergic drug is its classification first, then after its uses and adverse effect, and also about the atropine poisoning and treatment. So, okay, so these are the important topics which about which you know, about the knowledge about which you should have. So before going to the anti muscarinic drugs, let us first understand what are the uses or what are the things that the muscarinic receptor doses, or what happens when acetylcholine stimulates our muscarinic receptors. Okay, so very first thing that we're gonna study here will be the about M1, M2 and M3 muscarinic receptors. So very first, M1 muscarinic receptors, it is located in the autonomic ganglia, gastric gland and CNS. Okay, M2 receptors in the heart, and M3 receptors in the visceral smooth muscle, iris, ciliary muscle, exocrine glands and the endothelium. So you should read actually this you have a nice table in the K Tripathi book. Okay, you can make a note from there and you can paste it on your wall and remember every day. So this I have just taken 2 points, that is location and functions. These are very important thing. Okay, these receptors and their location and functions, and these are very important, very important. Okay, please, this is very important. The first M1 receptor, it is located in the autonomic ganglia, gastric gland and CNS. M2 receptors in the heart, and M3 receptors in the visceral smooth muscle, iris, exocrine glands and the endothelium. Okay, now the functions of what happens when these receptors are stimulated by acetylcholine. There occurs depolarization, there occurs gastric secretion, there occurs learning, memory and motor function. So whenever acetylcholine stimulates the M1 receptors, we go to depolarization, there is gastric acid secretion, there is learning, memory and motor function. In heart, it causes the hyperpolarization, because of which there is decreased velocity of conduction, there is decreased contractility in the heart, whereas in the M3 receptors there is contraction of smooth muscle, constriction of pupil, vasodilation by releasing NO. Now friends, today I'm gonna give a little bit tip and little bit suggestion how to remember all these things. You might get confused whenever you are studying alpha receptors, beta receptors, M1 receptors, nicotinic receptors. So muscarinic receptors are parasympathetic. Okay, so at first, I will suggest you to study the sympathetic stimulation and parasympathetic stimulation. Okay, in sympathetic, when you try to differentiate between the sympathetic and parasympathetic, you will definitely get the knowledge that what happens when these receptors get stimulated. First of all, okay, let me go with the heart. You know that in heart, in sympathetic stimulation means fright and flight response. So during the fright and flight response, our heartbeat increases. We can very easily tell that. So definitely that means that in parasympathetic stimulation, our heart rate decreases. So decreased velocity of conduction and contractility. I don't think we should have any doubt regarding this. Okay, sympathetic, if heart rate increases, then definitely in parasympathetic heart rate decreases, and muscarinic is the parasympathetic receptor, so there should be increase in the heart. Now, in the M3 receptor, we have got visceral smooth muscle, iris, ciliary muscle, exocrine glands, and endothelium. Okay, so in this, one thing that I have written, constriction of pupil. In the sympathetic stimulation, what happens, there is dilation of pupil. Okay, because we have to look the things clearly. No, whenever we are afraid, we just dilate our eyes and we make them big to look at the things clearly. So this dilation of the eyes, that means that in whenever there is muscarinic stimulation, there should be constriction of eye, constriction of pupil. Okay, okay. Now There are few like contraction of the smooth muscle. Usually there happens a contraction, and there is the vasodilation by releasing NO. And also, during the sympathetic stimulation there is decrease in secretion. A lot of times there is decrease in secretion. So whenever gastric cleanse comes, you can usually write that in parasympathetic there is increase in gastric secretion. Okay, learning, memory and motor functions they work properly. So that's it. Now we have already studied about one M1, M2 and M3. Now keeping these things in our mind, now we will be discussing about the other things like atropine and the uses of muscarinic receptors and the muscarinic drugs and the disadvantages adverse effect of the muscarinic drugs. Okay, so at first about atropine. So atropine is a prototype anti-muscarinic drug obtained from the Atropa belladonna, that is known as a datura. Okay, so it is a tertiary amine, and the thing is it crosses the blood-brain barrier and shows the excitatory CNS effect. Blood-brain barrier, if it crosses the blood-brain barrier, definitely we can relate something, with if we had got any adverse effect in our CNS. So the uses of atropine are not very important, but there are few things that you should know. CNS, so it shows the stimulatory effect at the high doses, and hyoscine produces a central effect even at the low doses. In severe, the most prominent effect is tachycardia. Obviously, if atropine blocks the muscarinic receptors, that means which has muscarinic receptor usually used to decrease the velocity of conduction contractility, and if it has blocked that thing, that means obviously we are going to get the increase in the blood pressure or increase in the contractility of that is tachycardia. So it also dilates the cutaneous blood vessels. It decreases the vagal tone. It M3 receptor blocks the pupillary constrictor muscles in the iris. So we have this near constriction of pupil. So it is a blocker. It is a M3 blocker. That means that it also, if it used to dilate, then if it used to contract, then it blocks the M3 receptor in the ciliary muscle, that is the constrictor muscle. So it's just very simple. Okay, so blocks M3 receptors at the lacrimal gland means secretion, resulting in the decrease in lacrimation, hence the dry or sandy eyes. In respiratory system also it decreases the secretion. In GI tract also it decreases the secretion, salivary secretion, this and that. And body temperature, because there is decrease in the salivary secretion, because there is decrease in the sweat gland secretion, there is elevated body temperature, because sweat glands helps to maintain the body temperature and keeps our body moist. But then there is decrease in the sweat gland secretion, there is dryness of the eyes. So it helps to make the skin dry. It decreases all the secretions in the mucous gland, acids, whatever it is. And in the respiratory system also it causes decreases the secretion of nose, mouth, pharynx and bronchi, so dries the mucous membrane of the respiratory tract. So it also decreases the secretion of lacrimal glands, resulting in the decrease in the lacrimation or hence dry or the sandy eyes. So definitely whatever you have to write the uses about the atropine, you can just write these two things, these four six things, and just write opposite of whatever the functions we have written here, and you will get the effect of the muscarinic receptors. Thank you so much guys. Please like and subscribe to my channel if you like this video. I'll be bringing